In this tutorial of adolescent players, we can look to explore very closely both some very typical reoccurring postures that can certainly appear and be very, very evident when looking at these adolescent players through those kind of maturation years, and really how these adaptive postures can connect back to and influence then how they move and swing. So you'll see on screen here, we have a very typical example of a very common reoccurring teenage posture where through those adolescent phases, because they haven't yet quite got the development of control through that deep postural system. So when looking at movement, we can really look at it in two ways. When looking at posture, for example, more what we call the tonic system. So the tonic system is those muscles that sit very deep and close to the bone. So in essence, the muscles that really you can't see in some ways, that sit closest to the joints and closest to the bone. And so that tonic system is in essence what gives the frame its shape and provides that wonderful, robust, durable frame that we then have to move around. And then equally so, what we then call the phasic system is the movement system, the big superficial muscles, things like pec major, latissimus dorsi, quadriceps, those big movement muscles. And those phasic muscles are typically what then kind of give this system the ability to move. So often what you look at within adolescent players, very much like we see on screen with this particular player here, is a real imbalance because of where they're at through growth. So often the skeletal system grows much quicker, grows at a much more advanced rate than that kind of deep tonic postural system. So often they kind of get into these slightly kind of compressed fetal postures that we can see on screen here. So some very evident visual representations of these teenage postures can be that very pronated feet. So you look at both feet and they live very much on that medial inside border is actually much more evident through that trail foot in this particular player's case. And then in addition to that, something called valgus knee, when the knees very much sit inwards. So therefore that then influences both how the femur, the long bone in the upper leg, goes into the hip joint, and equally so then how the pelvis and then lumbar spine and sacrum start to orientate and match up. So typically in these adolescent postures, what we can see is that kind of pronated feet, valgus knee, pelvis held in slight anterior forward bend, very narrow through the pelvis, so really constraining and making it very challenging to then produce rotation through the kind of hip joint, pelvis into lower limb. Equally so then looking more up top, what we can then see on camera in this particular player is that very rounded forward compressed rib cage, very depressed rib cage pushed downwards, the humeral head, the scapula very much forwards and protracted, and how much the head sits downwards, even though this young player is wearing a cap, how invisible in many ways they are through face and neck. So we then move this player into backswing, some pretty evident movements we then start to associate and connect back to that kind of very adolescent posture. So you'll see here through on screen that real evident shearing, the excessive elevation and extension and disconnection through that right shoulder. So the elevation and extension through the spine, the disconnection through that trail shoulder, as you see on screen here, is often very evident and very prevalent and certainly very representative of when that deep tonic postural system, which is kind of yet to develop, normally starts to develop when those growth plates really start to fuse in those kind of late teens, early 20s, 21 years of age, that kind of area. So they get very reliant, very dominant on that movement-based system. So often they use the big lats, the big erector spinae muscles, the big pecs, the big quads, the big rectus, those big superficial muscles to produce movement, which is often then why you see these real elevated, extended spines and rib cages, kind of reduced connections through areas such as that trail scapula. If we then move them into downswing, so you'll see here just post-impact is a nice example. Often what's very evident, once again, and certainly very notable in many adolescent players, is the lack of rotation through head and neck, so they can get very active through ribcage and pelvis, and that head and neck's held in that very kind of clockwise position, as you'll see with me here through this tutorial. They then get very overactive through hand and wrist. So you kind of look at those imbalances. They get very overactive through hands and wrists because they're very inactive through often rib cage and head in this case. So once again, what allows that kind of head, neck, rib cage, pelvis to rotate in a much more kind of matched symmetrical way, a lot less activity through hand and wrist, so nowhere near as much pronation through the trail forearm, supination through the lead forearm, extension in the lead wrist, flexion in the trail wrist, radial deviation in both. The real activity through both hands and wrists often comes back to is not because they're active through hands and wrists, it's more because they're inactive through head, neck, and rib cage. But once again, when they live in these very compressed, very fetal, very depressed, as in depressed anatomically, postures which are connected back to where they're at to that maturation phase, because once again they have the movement system developed or developing, they have the skeletal system evolving, but the deep tonic postural system, it gives us that wonderful frame, long necks, wide rib cages, lovely length in the spines, often doesn't start to mature, and the growth plates in some of these fuse until often around the age of kind of 20, 21. And even then personalities, you start looking at what can happen during that kind of maturation cycle, that often personalities can be slightly often introverted, just because of often where they're at, once again, more in that emotional development they're going through. So often their personalities, that slightly introverted, often sometimes slightly kind of, nervous and often slightly shy, just because of where they are at, once again, can often then migrate into those postures that they have. So kind of based on what we now know about kind of adolescent posture, and in some ways the order those systems grow, ironically, the last system really to truly evolve during adolescence is the neurological system. Why? Because it's the one really kind of least, not deprived of blood, but it kind of gets blood supply the latest. So that real wonderful neurological system, the code of movement in some ways, that neuromuscular system that we have, can often be the last of those real dominant movement systems to evolve and develop. So really, how can we now start to use some movements, some awareness, some exercises to really help the awareness of standing, and also that much better connection through neck, hand and arm, shoulder blade, rib cage, lower limb alignment. So really looking at what movements can we do to really then improve the lower limb, foot, ankle, knee, hip connection, spine, rib cage, shoulder blade, hand and arm connection. Let's start to explore some drills we can use to help move away from these very common adolescent postures. So really, what exercises can we use to really help players, or certainly the young adolescent players, move away from these very kind of fetal, compressed, often postures connected with kind of adolescent players? The idea of the feet being slightly pronated, kind of knee valgus, very kind of forward in the shoulder joints, kind of down and compressed to the neck and head. So just using a mini band, in this case you'll see the band here placed just above my knee. So certainly for adolescent players, perhaps place it above the knee rather than below the knee. The lower down it goes, often the more challenging and demanding it can be. And then with a piece of tubing in a loop like so, place that at the back of the shoulder blades, and then place the hands forward so the elbows are down, the palms are facing forward, almost kind of hands up in some ways like so. So from the target line view, kind of elbows down, hands forwards, being very aware of that, adapting the feet and allowing the feet to kind of roll outwards onto the lateral border. Let the knees just very gently, only kind of maybe 2 or 3 degrees, slightly rotate outwards, but still keeping that good kind of tripod connection through both feet. So just start to stamp through both feet. And as you stamp through both feet, using the elbows and the hands, just start to circle outwards, almost in some ways with the trail hand, rotating clockwise, with the lead hand rotating anti-clockwise. So as we stamp through the feet, so actively stamp through the feet, rotate through the elbows and the hands outwards. So the idea of kind of moving much more into that external, expanded posture rather than that very compressed, internal, slightly fetal posture. So once again, with the knee band above the knees, keeping good connection through the feet, just slightly rotate the knees outwards, elbows down, hands up and forwards, very much like we see from the target line view. Then just start to coordinate, stamping through the feet, rotate through the elbows, and as you start to stamp and rotate, then just start to rotate into backswing, hold for 2 or 3 seconds, start to rotate into through swing, allowing the head and eyes to very much rotate the neck. So we're being very aware of that spine control, the neck control, the shoulder blade control, the pelvis lower limb control. So as we rotate at all times, stamping, rotating through the hands, that clockwise, anti-clockwise direction, rotating to finish, being very aware of that wonderful postural control we have, both in standing and also through swing. So just using this little drill with the tubing and the mini band can often really help those kind of younger adolescent players, really help move away from that very internal, very compressed posture, much more external, much more expansive, longer spine, really much more space in width through those shoulder joints, hip joints, lower limb, to then really help them move into that wonderfully expansive rotation as they move through swing. So hopefully these drills we've just showed there will help as far as really giving the awareness of standing, the long neck, the wide rib cage, the connection through the scapula, the lower limb alignment, the pelvis lumbar spine control. And much of what we've just walked through then on that exercise in the little rotation and stamping is actually very much designed and developed for improving and developing that tonic deep postural system. So areas such as the lumbricals, the muscles through the feet, the adductors, the glute med, glute min, multifidus, transverse abdominis, serratus anterior, lower traps, lower trapezius, triceps, all those muscles that really give us that wonderful, robust, durable shape. The drill we've just gone through then can really help both improve the awareness, the control, the endurance of posture, which also then connects back to how they can move in their swing. So often when you start to see and are presented with these very common postures we see on screen now, let's start to use and explore the drill we just played with, and then really start to how that connects back to both their awareness of standing and then how these young adolescent maturing players start to then move and develop in swing.